Well, good morning from the west coast of the United States. We have folks joining from around the world, and many of us are working from home. I think it's amazing how the coronavirus disease has changed our world in such a dramatic way, and we hope that you, your loved ones, and your communities are safe and that you're all helping flatten this global curve. My name is Mike King, and I serve as a director in our emergency communications solutions industry. And our webinar today is focused on tools that Esri has made available globally to assist you and your PSAPs in your response to COVID-19. Our maps and applications, along with the science behind the scenes, is being used by government agencies around the world. In fact, in the last 30 days alone, our public safety team has provided through our disaster response program software and support to more than 3,000 governments and organizations who are asking for help in the fight against this pandemic. Today, we're going to be privileged to hear from two of our top scientists in this battle. Dr. Este Geraghty, who is our Chief Medical Officer at Esri, will be joined by Phil Mielke, a product manager. They both have a great deal of experience in working with data and data used by PSAPs, and especially as we focus on this COVID data that's becoming available. I'd like to thank our colleague Brenda Martinez, who's managing the event, and make mention that Britt Bromley, our public safety business partner manager, is going to take care of any questions that might come in, and he will close out the webinar with a few remarks at the conclusion of Phil's comments. So with that, let's begin and turn the time over to Dr. Geraghty.
Thanks so much, Mike. Good morning, everyone. I do really appreciate the opportunity to share information with you about the GIS tools and data and resources that are available to you at this difficult time. This will be no surprise. Coronavirus or COVID-19 disease is creating massive public health and broad-based governmental challenges for jurisdictions and communities across the globe. Those challenges include coordinating data resources, maps, and information products across all sorts of different but relevant departments, not to mention also there's a great need to share information with the public. So today I want you to think of a GIS, a Geographic Information System, as an enterprise system for pandemic response. It's being used broadly from health responders like the World Health Organization, to university researchers, to disaster agencies like FEMA and the US military, and hundreds, if not thousands, of local governments like St. Johns County, Florida, are taking advantage of the tools that we're providing freely so that they can support their populations in a very holistic way. Now, take just a moment to say that if there's anyone on the webinar who's not familiar with GIS or thinks that a GIS is just a map, I do want to assure you that a GIS is truly a comprehensive and integrated system for lots of critical workflows, including the one that we're going to focus on today, which is understanding and responding to pandemics. In this case, you're definitely going to need a GIS support team that can facilitate the key mission areas, like disease surveillance, like your planning and logistics, and all of those people who are out in the field and need some technological support. And then there's making sure that the executives are aware and can make those important management decisions, as well as facilitating community engagement. Now, you may have seen something like this before, but GIS really provides a framework and a process, and that framework and process is used for almost every kind of application that people need to perform. I like to think of it as kind of like a workflow. And we know that it all begins with data and measurement, which we then want to be able to visualize and analyze to gain a deeper understanding of what's going on. And that helps us to get to those stages of planning and decision making and taking action. Now, in the unique case of COVID-19, there are some more specific kinds of information products and data sets that can be used in this kind of a workflow model. So we measure things like healthcare facilities and cases, demographic information, and our vulnerable populations. We communicate with strong mapping and dashboards. When we get to analytics, we're looking at things like forecasting and understanding impacts. We do intervention planning like social distancing to stop the spread of the virus. And then we do testing and treatment, focusing on site selection and choosing the right locations for those kinds of resources. As you may know, that site selection piece in particular is kind of old hat for GIS people. But the system also helps us to allocate the where. Where do we put equipment or personnel based on the needs that we have, or even those future forecasted needs as this evolves and progresses? Finally, this framework and process it allows for a collection of tools that help us to engage communities. And the whole thing is truly data-driven and science-based. So, where do you start? Well, I've developed this 5-step framework for understanding the impacts of COVID-19. So just about anything that you would want to do with GIS for this pandemic, I think fits into one of these 5 areas. I haven't thought of anything that doesn't fit yet. So those areas are: map the cases, map the spread of disease, identify and understand the vulnerable populations, map the capacity of your system to respond, and communicate with maps. So let's take a few minutes to look at how some organizations and governments are operationalizing these steps. So when I talk about mapping the cases, I'm talking about the confirmed and active cases, the fatalities and the recovered cases. You need all of that information to get the overview that you have to understand the current situation. So for that overall situational awareness, I'd have to say that no one dashboard has been relied upon more heavily than the Johns Hopkins University dashboard, which has literally been requested over 1 billion times since the beginning of this crisis. Step 2 is to map the spread of disease. Now, epidemiologists often look at the number of cases happening per day to see the way that the outbreak is distributed over time. What I'm suggesting when I say map the spread, it takes that kind of to the next level, and it adds the geographic spread as well. Because when you know the direction of geographic spread and the pace of disease spread, you can determine when and where you're going to target interventions like shelter-in-place instructions. Now, this example that you're seeing comes from the University of Virginia's Biocomplexity Institute. They actually have developed a really nice app here. Excuse me. It's from talking too much, not from any illness. You can see the day-to-day time slider across the top here, the number of new cases per day in the graphic on the left, and the mapping cases over time in the map area. Okay, so step 3, that one is about mapping vulnerable or higher risk populations. Now, some folks are going to be at higher risk of severe disease. That's going to be people like older adults and people who have chronic medical problems, or we sometimes say medical comorbidities. They may be at higher risk, or some may be at higher risk for transmitting disease. That could be people who live in high density populations. And there are other relevant factors that are distributed differently across our communities. So I'm going to show you some examples of step 3 in Kansas City, Missouri. Now, this first map that you're seeing shows where we have high numbers and high percentages of seniors across the community. And here we're looking at the population density, where lighter colors are high density areas. And so you would consider that you probably have more interactions there among the residents. Now, the CDC has made their social vulnerability index available so that we can look at this single index that provides 15 different measures of social vulnerability and see the areas of highest concern, like those in the dark blue color. And in this last map, we can see in the red areas where there's a greater proportion of the population that's lacking health insurance. Now, once you understand your vulnerabilities, you'll want to determine your capacity to respond. For example, here we're looking at New York City, which of course has been in the news quite a lot lately. Across the top, we're showing basic information related to the population of New York City, the number of households, things like median income and median age. The next section you're seeing is based on the CDC's current predictions for infection rates, for hospitalization rates, intensive care unit needs, and the fatality rates. But what they've done that's different from what you've seen elsewhere is they've divided it by different age cohorts. So our role in creating this infographic was simply to calculate that through for the population, in this case, the population of New York City. And so this kind of information really offers you insight into a particular jurisdiction's overall capacity needs throughout the duration of the event, right? This is a single look. Now, to examine this idea of capacity a little further, in this example, we're seeing Jefferson County, Tennessee, and their hospital bed capacity information. So the data here comes from an organization called Definitive Healthcare that has basically donated their data for the duration of this event. And what you're seeing in the map is the county boundary for Jefferson County, Tennessee. And maybe you can see the hospital. It's a tiny little purple dot in the northwest part of the county, but if not, I can help you there. So this particular hospital has 58 staffed beds. So this is a smaller county, and that's not a lot of beds. But if Jefferson County was going to start to see a lot of cases, they would want to look at their neighbors potentially to see if they can handle the overflow. Here, the University of Tennessee Medical Center has 609 beds in their system. But actually, we can get a lot more analytical in this step 4 of mapping capacity. So in this case, I'm using data from the state of Florida, since they've been really great about sharing open data during this pandemic. And what you're seeing here is something called the CHIME model. This comes from University of Pennsylvania, Penn Medicine, and their researchers, and they are just one of several models meant to measure surge in the health system. And so what you're seeing here is the result of scenario planning to see when and where hospital capacity may be exceeded. So first, look at the curves in the left panel. With good social distancing, we can see that the curve is flattened and the peak of hospital bed need happens at around day 55, and it's much lower than the curve on the right, where the peak happens at around day 38, and the number of beds needed is going to be much higher. And of course, when you look at the maps supporting this, it's showing us the places where those needs are going to be greatest across the state. Now, the fifth basic step that I wanted to share with you is communicating with maps. And many of you are probably already doing this. Let me give you some examples. Valley County, Idaho, and Leon County, Florida are actually both thinking about businesses. So they're not the public health organizations, they're thinking about businesses and how they're impacted and how they may have adjusted their business models to be more resilient during this difficult time. Now, many jurisdictions, like the state of Arizona, are providing public information about school closures and event cancellations. And I think you can imagine at some point, these kinds of applications will be reversed, right? They'll be showing the opposite information as we move toward recovery, like which schools have reopened and which events are now rescheduled. In Boone County, Missouri, they've used these county impact planning reports that we created to gain insight into the community characteristics that's going to help them with their planning and response. And like I said before, understanding some of those vulnerable populations. Here in the upper left, the state of Alabama has implemented a testing site locator so that people are able to use their mobile applications or their computers to find the nearest testing center and navigate there. And early on in the crisis, the state of Oklahoma shared nationwide airport impacts to bring awareness to travelers across our country. So now that you have this understanding of my 5 steps, how do you take action? Well, you start by implementing the COVID-19 information model, and I'm going to show you that next after this slide. But then you begin your community risk analysis. You'll look at the social distancing data to see if it's flattening the curve in your jurisdiction. Phil's going to talk to you more about that. Or you're going to be able to determine if you might need stronger interventions or different messaging to your community so that they really get it. You'll keep an eye on the daily spread of disease as you run your forecasting models for hospital bed capacity. And as needed, you'll cite locations for new resources, things like testing centers or alternative treatment locations or food distribution sites. Now, it all begins with the information model. Now, based on our interactions that we've had with our customers over these last 8 to 10 weeks, these are some of the data sets that we understand are most useful at this particular time. So starting with demographics, you're going to want to collect that socioeconomic information. Obviously, age cohorts are important for COVID-19. We're starting to see more and more racial disparities, so collecting that information will help us to mitigate those problems and provide more equitable services. We're going to look at health conditions and find out where there may be pockets of people who have higher levels of risk because of comorbidities. We'll look again at those vulnerable populations and consider behavior and lifestyle information for that messaging part of what we need to do. And then, as I mentioned before, population and housing density are very important. When it comes to cases, we want to know the confirmed cases, those that are hospitalized or requiring that higher level ICU care, who's recovered and who has passed. In a similar way, we're looking at people who've been tested, and you want to be able to collect your confirmed positive tests, your confirmed negative tests, and then your unknowns. For hospitals, we need to be able to understand a hospital's catchment area or service area and what portion of the population is utilizing each particular hospital's services. Then we want to get into capacity information, like in general, how many hospital beds are there and how many are dedicated to intensive care units. But then we need to understand the current situation with that hospital occupancy rate from COVID and non-COVID reasons, and how many ventilators are in inventory and currently in use. Then, as I spoke about with that CHIME model and forecasting demand for hospital services, you want to be able to determine when do we get to that peak number of beds, ICU beds and ventilators needed. Are you going to have to expand your hospital capacity and services in your area? And what is the duration when that for that oversubscribing to hospital services? You need to have a sense of that information as well. And then we look at some of the preventive efforts that we've put into place, like social distancing restrictions. Those vary, as you well know, across the country and by jurisdiction. So in some places it may be school closures and event cancellations, whereas in other places they're asking you to only do essential kinds of traveling. To other places that are shelter in place, and maybe for some populations, for some people who've had exposures, it may be a full isolation or quarantine. To understand if those social distancing restrictions are actually having an impact, we can start to look at mobility. And again, Phil's going to go into this in much more detail, but basically we want to be able to see if there's been a net change in movement over time. And what I mean by that is, has the current travel decreased compared to pre-COVID-19 days? So that'll give us some insight into the effectiveness of social distancing in our regions. Then we can look at average distance traveled. You would assume that that would be shorter, that travel is going to be much lighter distances in local neighborhoods, just going after essential goods and services. And you'd see an increased percentage of people's time at home. And all of this data is available and possible to use in your models. Next, we think about, do we need to expand our services in any way, whether it's expanding hospital services as alternate care sites, or testing centers or food distribution centers. So for alternate care sites, you're looking at places that can accommodate people overnight, that have the capacity to include all of the equipment needed for healthcare, that's close enough to hospitals and healthcare providers, but separated from them. So you may look at decommissioned hospitals or prisons. You could look at university dormitories, hotels and motels, and ships for this purpose as candidate potential locations. For testing sites, you might be more interested in places that have really good ingress and egress for high levels of throughput, because you may want drive-through testing sites and the ability to have walk-up testing. So here you might think about convention centers, large parking lots, schools and public buildings. So I've already given you a lot of information and I'm not even quite done yet. But it's possible that you're in a situation right now with all that's going on where you have some technical and time constraints and you really want a quicker and easier solution. Well, I want to make sure to tell you that we can help with that. We've, through this process, created 2 solutions that you could download and use right away. Now, the first one is the COVID-19 Response solution, and that one is going to help you to report, track, and monitor the cases in your community. It'll help to track the changing status of public gathering places like the schools and government facilities that may have closed. You can inventory the places where people can get testing and treatment, like testing sites, hospitals, and clinics, and then provide applications to keep people informed so that they're aware of all of these different things, the facility closures and places where they can get care and stay healthy and safe. Now, secondly, we have a business continuity solution. Now, this one is critical for helping organizations of all kinds, can be government, can be commercial types of organizations, but every organization has different work situations for their employees, right? There are still some people who need to be out there in the field, and there are also people who are working virtually from home, lots of different situations here. So organizations want to be able to better manage their employees, they want to be able to manage their facilities, and they want to be able to provide really clear and potentially changing external communications about what their business is doing during this time as things evolve. Now, both of these solutions come with software, several components of software and support services, and basically have everything that you're going to need to deploy them and use them very quickly. And to help you get going, we have several different resources for you. Let me start with this first one. There's a blog post that outlines how to deploy the ArcGIS Hub template for coronavirus. And I'm going to show you that in a moment, what the Hub is. And that only takes a couple of clicks. It's really easy. But if you need inspiration, like you're not sure what you want to post on your Hub site, we've actually curated a collection of Hub sites from around the world. So you can take a look at those. They're great models for how to share information, data, and tools within your own communities. We also have written and video instructions for deploying these solutions to help you get going. Now, as I mentioned, ArcGIS Hub, this is a great way to make information usable and accessible for everyone. And people need that single place where they can go to find authoritative information that's relevant to their community. So for both of these solutions, we have tailor-made ArcGIS Hub templates for you to stand up and use. But to give you a sense of this, I wanted to show you the Esri example. We deployed our own ArcGIS Hub product to serve as our one-stop shop for the tools, data, and services we're providing related to COVID-19. So please take a moment, capture a screenshot of this URL, because everything that I've already spoken of and will talk about in the next few minutes is right here in the COVID-19 GIS Hub. So I'll give you a brief tour of some of the contents. First of all, you should know that we are updating the contents every single day. So to make it easier, we put that on a banner at the top. So you'll see every day what's new, check back often, because like I said, it's frequently updated. And second, we're highlighting the fact right up front that you can request GIS assistance whenever you need it. Now, the first thing you're going to see when you scroll down in the hub is the World Health Organization dashboard and the Johns Hopkins University dashboard. I also want to encourage you to check out these two new applications, which organize the different dashboards and applications around the world in a system of systems of approach. So that first arrow is pointing to the US maps and apps, and the second one is for the world. So you can explore whatever is interesting to you. But let me show you what the US example looks like so you have some context for that. In the white map in the lower left-hand corner, you can select a state, and when you do that, you'll see the different tools that are created by that state or its counties or cities. So it's really fun to go through. And on the green map to the right, you can create infographic reports. I showed you a little bit of that earlier. So it would be something like this one for the state of Kansas that would give you important population characteristics to consider when you're thinking about the impacts of this disease. Now, next, you're going to see that the hub is basically organized across three broad areas: getting started, getting data, and getting updates. In the Getting Started section, no surprise, you're going to see the 5 steps that I covered earlier as a framework to support your understanding of COVID-19 and the impacts. Again, those are mapping the cases, mapping the spread, looking at your vulnerable populations, understanding your capacity and ability to surge, and communicating with maps. In the Get Data section, you're going to find some featured data sets, like school closure information, hospital bed information, current COVID-19 data at the county level, the CDC Social Vulnerability Index. We even host data sets to help you measure the success of social distancing measures, like the Unicast data that provides grades by county, or the SafeGraph data that goes down to block group. If you go to the bottom of this section, you'll see a button to view more data sets, and you'll find more information on demographic data, population density, chronic disease information, facility information, healthcare provider data, real-time traffic data, and much, much more. We've been busy, folks. Now, this section for getting updates provides both professional and public level information from our most authoritative agencies: the World Health Organization, the US CDC, and the European Center for Disease Control and Prevention. Now, I want to bring your attention to the upper right-hand corner and make sure that you see and explore the resources page. Here's where you get all of those tools that you're going to need. You can launch either or both of our solution sets, that business continuity solution or the community response solution. Next is our guidance section with blogs and tools that help you to follow best practices, whether you are wanting to map coronavirus responsibly or you're trying to protect health or personally identifiable information. We've also put together a number of how-to resources that are going to help you do the specific work you need to do during this pandemic. There are blogs, videos, and short tutorial-style lessons in this section. And hey, I know we are all working together to keep ourselves, our community, our nation, and our world healthy. And lots of people are wanting to help. So for those who have GIS skills and they want to volunteer their services, we're directing them to the ERISA GIS Corps of Volunteers. And for technical discussions around COVID-19, we set up a special GeoNet site to host those conversations so that everybody can help everybody else. Finally, when things calm down a little bit and we get to that point of we're in debriefings or after action reports or examinations of our lessons learned, that's when I think that you'll probably want to see some of these more long-term resources to help you, if you're not already, get set up with GIS in bluer skies to be even better prepared for the next emergency, whether that's a fire, a hurricane, or a public health crisis. So as you think about using GIS to address the COVID-19 pandemic, know that the technology, it's here for you. It works very well, but this effort, obviously, I know you know this, requires more than technology. You need a strong champion and leadership involvement to make things happen. Your mission is going to drive your strategy, and you really need the questions that you're asking of technology to be clear and focused on the most important issues. Your internal governance processes are really critical for how you're going to share your data internally with your partners and with the public. And of course, there is a very important, I would say, heroic role for your GIS professionals to make this entire system hum. And with that, I want to say thank you for giving me the time and hand this over to my colleague, Phil Mielke, to talk to you about some of the really exciting data sets that we have available. Phil?
Thank you, Esri. So we've been working with some of our partners and data providers in order to be able to deliver a kind of a unique picture for what's happening here, and it's very relevant. We're talking about social distancing and mobility data. This is information that is typically used in commercial settings in order to identify, the number of people that visit stores, which stores are more popular, which areas are more popular. And it has typically been the case that this is used for site selection or determining where to make the next store closure from some larger brands. So we saw an opportunity here, and a lot of the data providers that we work with have been very generous in providing this data free of charge for use in response around the COVID-19 efforts here. So, and we've made this data available on the hub, which Esri shared earlier. And you can find this data and start working with it now. I'm going to share a couple of tips for how to work with this data, some basic web GIS skills. And I'm also going to go into the detail of the kind of data that we have and how it's broken down. But first, to answer a little bit of an overview question here is ultimately, what is mobility data? So in this case, we are gathering, these partners are gathering and aggregating an analysis of data that's gathered from apps that have been used to collect and send information to a central repository. Now, there's over 300 of these kinds of apps that are typically, they range as far as the usage. It's games, sometimes navigation types of apps. But the way that these apps make money is to ultimately sell location information to a central location. And then some of these third-party providers, they end up aggregating that data and making it useful. Now, the raw data, to give you a sense of it, worldwide is estimated to be about 1.7 terabytes daily. Those are individual points that are moving from location to location. And that brings up the question, well, what about privacy in this case? Well, the first thing to know is that this data is aggregated and it's anonymized. It's not possible to identify individuals in this data. And in cases where that data may show over home locations, those home locations are randomized in order to de-identify individuals. And the other question is, well, how many people could this possibly be accounting for? I mean, what kind of apps does everybody have on their phone that is potentially tracking them and sharing this data that could then be used for good? So we estimate that there's about 3% of the population then that are using these apps. So it's not a perfect thing to show everybody. We can't answer questions like, did this infected person connect with another infected person at some point, and therefore can we warn that other person that they might have a risk of being infected? This is a little bit different than that. This overall, with this sample size of the population, this gives us a pretty good mirror of population's behavior. So when we're taking a look at block groups, for example, we're able to round up and surmise activity that is related to that general area using that aggregated data. So you get a sense of some trends, both at an aerial geographic unit like block groups, or at individual locations like points of interest. Well, what can you do with this data? Well, you can't do anything with the raw data unless you're purchasing it directly and using a big data toolkit or other forms of big data analyses. But in this case, we've aggregated the data, or these third-party providers have aggregated the data to make some useful information products that can be immediately actionable. So let's take a tour. So one of the first ones that we were able to get here is a Unicast social distancing by counties. So this is updated daily. It's estimated to have about a 5-day lag for processing time. So, it takes a while to bring this data together and to process the total metrics that are involved with calculating these grades. And ultimately, this is built on a comparison of pre-COVID-19 movement patterns. So that comparison that's being made in order to develop this grade is differences in daily distance traveled and then visits to non-essential location. Seeing how those have changed from pre-COVID time periods helps to give a percentage difference for that kind of behavior and activity, and that percentage change turns into an easy to use and understand grading system, so that you can see this data change over time and help to identify those locations in your counties, your states, and ultimately federally, how well this social distancing is ultimately occurring. So that's at the county level. It's a very useful set of data to work with, and we make the latest day available. Another great data set to work with here that SafeGraph has just recently shared is the social distancing metric. So this is block group level data, which is updated daily and is estimated to have a 4-day lag. That you can get into greater detail this way in order to understand, within your jurisdiction and the areas that you're concerned about. And this is visualized here by the percentage of devices that are staying completely at home. And completely at home accounts for a 200-meter movement for walking around, which is still encouraged. This also contains data in fields on part-time work behavior, full-time work behavior, and median distance traveled. So you can do some really interesting things with this data. It comes visualized like this, but I'll show you a little bit later how you can, say, focus on full-time work behavior and start to understand the picture of economic recovery as we get nearer to that. Another really interesting data set here is SafeGraph weekly patterns. So taking a look at it, you can kind of get a sense of this already here. This is updated weekly, and it covers the previous week's data in terms of how frequently the individuals that are using these apps that share their location information are gathering at these forms of locations, so that you ultimately can do things like view a daily visitation information as a line graph in a pop-up. And you can also filter by category of these points of interest, so that you can do a variety of different workflows, identifying non-essential venues in operation, for example. You can determine capacity at food banks, shelters, testing facilities, really get a sense as far as how the traffic has changed at these facilities. And then you can identify busiest outdoor public spaces, for example. I know that this is a workflow that a lot of local law enforcement is concerned about, and determining where it is that resources may be necessary to send in order to ensure that everybody is appropriately distancing. Another data set that we're going to see here probably today, this is Blue Dot county level social distancing. And this is also something that's updated weekly. It is county level in terms of the social distancing metric. It's a well-respected data set in the epidemiological community, and it also contains the percentage of devices that are staying at home. And in this case, I think the thing that makes it valuable is that it compares to pre-COVID baseline. So you can determine how is the picture of the number of people that have stayed at home changed. And yeah, ultimately, this is very valuable for things like the CHIME model that Este spoke about earlier. So I wanted to share some workflows for working with this data. In this case, we're going to be walking through how to filter and to symbolize SafeGraph weekly patterns information, as I think it's going to be really the most relevant to PSAPs as we're starting to understand that picture of what's happening directly in our community. So here's an initial view of that data, adding this into a web map. And then you'll notice that the ability to bring up a filter, and that filter here presents this interface where you have the chance to be able to enter in a number of different filter queries here. So in this case, we're going to pull out our outdoor locations and golf courses. So we're making a few selections here. Outdoor locations is actually under museums, historical sites, and similar institutions. And we're also going to add other amusement and recreation industries to this. So a little note here about this is that you need to make sure when you're writing this kind of filter query here using this the user interface within your web map is that you make sure to set this to display features in the layer that match any of these following expressions. So now that has filtered the specific data that we want to take a look at. And now we can see that it's over parks and golf courses. And we can start to get a sense as far as the volume here, but we want to stylistically change some of this. So now we can select a dark gray canvas for a base map. You can see some of this starts to show a little bit more. It draws attention to some of these individual features. And now we're going to change the style to use firefly symbology in order to visualize this. So when you select that change style, you're actually presented with the multiple styles that are presented here. So this data is styled by category and by visits, so that you can see after we filtered it, we're able to distinguish between other amusement and recreation industries and museums, historical sites, and similar institutions. Well, the first thing that we're going to do for this is to change the types, the unique symbols, so that we can select each individual symbol here and then change that so that we're actually introducing a new kind of symbol type. In this case, this is our firefly symbology. Next, we're going to go and we're going to resize that visits variable. That's the count of the number of visitors that attended there during the week. And we're going to use that count in order to change the size of this. So we're going to increase the size here to 60 so that we're really able to see those venues that are really increasing in size and increasing in visitation, and really differentiate those that are not very frequented at the moment and those that have been very frequented. So when you apply that, then you can see we've already configured a pop-up for you to work with, and we can see the most visited one here has a number of visitors that are occurring daily. And in that pop-up, there's a little line graph there that shows you day over day and the number of attendees within that SafeGraph panel that have reached that have attended this facility. We're just going to rename this layer so that we actually made something different. This isn't the whole SafeGraph weekly patterns set, and we're going to turn this into SafeGraph parks and golf courses. Now the same thing can be done here for medical facilities, so that you can filter out the categories that are associated with offices of physicians, testing facilities, hospitals and other kinds of medical facilities. We have nursing homes in there too, and really get a sense of the number of attendees that have arrived at those locations. So it really also with the pop-up gives you that sense of change over time. This is really powerful data that there's a lot of different things that you can do with. And so far, there's a couple of dashboards here that I can share that have already been made with this data, even though it's only been made available here for a few days. This is an example here of a dashboard that that's being used in order to aggregate information of the total number of visits that are occurring based off of those types. So we've got retail, trade visits, accommodations and food services, and we can understand that volume of data, and it's broken down by the types. So in this case, out of those retail and trade, which are gas stations, which are general merchandise or grocery stores, and really get the sense to visualize that. And depending on where you go with the dashboard or what you select, that in turn is affected on the map. So by selecting grocery stores, the grocery stores pop up and we can see those. Same thing here in the case of retail trade and accommodations and food services. So by selecting restaurants and other eating places, this brings up all of the restaurants here. Now, this is one that I like because we're also focusing on that economic recovery story. This is an example of restaurants and bars in all of the state of California. So you're able to filter out not only by the categories, but you can bring data in and visualize this in different ways in order to satisfy queries and dashboards that give you a sense of the total collected visits over time, or the visits by these kinds of subcategories, so that we can ultimately identify the number of unique visitors and total visits and really get a sense of the metrics. Now this data, the weekly patterns data, is updated weekly. And so if you build a dashboard with this, you'll see these values change over time. Now this is also interesting. Using Scene Viewer, when you open up that item and you can open up the item within Scene Viewer, this is a visualization that extrusions are based on the total number of visit counts here. So we can see which venues and points of interest within Los Angeles are actually receiving a very large volume of traffic. Scene Viewer is a great way in order to be able to understand this data and to really pull out trends that are occurring, especially those that are quite a bit different than some of the other locations. You'll see things like very popular donut stores, for example, or you'll also see grocery stores start to really show here. So another thing that I wanted to show you in working with this data is visualizing variables in that safe graph distancing data set that I was showing before. So there's a lot of things that you can do here with this. When you add it to a map, you can change the transparency in the base map. I recommend a light gray reference map here. So that'll bring city names above, and you're able to really get a sense on where some of these things are. But some of the data that we also have here, when you're able to pull up the pop-up, is that you can see that we have not only the percentage of devices that are staying at home, but those that are showing part-time work behavior and full-time work behavior, as well as the median distance traveled from this block group, so that you can identify those areas that may have long commutes. So by working with Arcade, you can actually change the expression here that you're using to visualize this data, and it's a great little learning opportunity here to be able to edit this expression. And in this case, we're going to focus on full-time work behavior instead of the number of devices staying at home. So this is a pretty simple change where we're introducing now the feature of full-time work behavior devices divided by the total device counts, and then multiplying by 100. So what this ultimately does is change that visualization. So at this point, the map changes. This is now a percentage of devices that are with people that are showing full-time work behavior. So you really get a sense on where your workforce is with this. And it helps to answer some of those questions. I think all of this data can be actionable for a variety of different decisions, but I think especially this data that gets down to the detail of focusing on what's happening in your community is directly relevant to PSAPs. So I hope you'll get the chance to go onto our COVID Hub, bring that data into your own web maps, along with your own resources and assets and call information, and really make this a good bit of context to help to make some decisions. So with that, I'd like to introduce Britt Bromley to talk us through some of the rest of the resources that we make available in some other upcoming events.
Great, thank you, Phil. Appreciate it. So I'm going to take a pause here because there's been tons of great information that's been shared in this webinar so far, and a little bit overwhelming at some level. So just want to let everybody know that this webinar is being recorded, and we will be sending this link to these recording to everybody, all the attendees of this webinar. So if you weren't able to capture all the links and all the information, don't worry, the recording will be posted soon after this webinar. That said, also, if you were to just go to our Esri.com website, our main website, you'll see the most prominent thing right in the front is information about data and resources related to COVID-19. And that will then also take you to the hub that Este was talking about and also Phil was talking about. So there are some ways that you can right now, right after this webinar, start exploring some of these resources. In addition to the COVID-19 resources that we've been talking about, there's some other industry-related resources that everybody has access, and those are on the public safety website on our main page. So please explore those. Maybe today the real focus is around the COVID-19, but there's many other templates and solutions that we put together for partners and end users to explore. The other thing that was mentioned during the webinar today is the idea of having a good GIS support team. And I'm going to talk a little bit about our partners here, is that if you need additional GIS staff resources, Esri certainly can help you out with that. But we also have a vast, large, a great partner community that can support you. So please let us know, if you have the resources internally that can support you, that is wonderful. If you need additional, reach out to us. We can support you directly from Esri, but we certainly can get you connected to the right partner that would meet your needs. So that's something we want to, make you aware that we have a great partner community, and they're there to help you out. The last thing I want to talk about is about our events and how to contact us for this year. So, you look on this slide here that we have upcoming events, and some have passed, some are right happening as we speak, or I should say really have been canceled. Others are, in question as what's the status of those. So as many probably aware, there's a lot of question marks as to what's being postponed, what's canceled, what's still running, what's on, and we'll keep you posted as related to the events that we support, that we run. We'll keep those our websites updated as to which events are going and which are not going. We hope to see some of you at some of these events this summer and this fall and winter, but again, we're just going to have to keep up to date on which events are being postponed or potentially canceled or offered in a different virtual manner. So the last thing I would say is that if you have any questions, whether it's related to this webinar or something completely unrelated, please reach out to us. Mike King's contact information is here, but if he doesn't have the answer, he certainly will reach out to the team, and we will definitely get back to you on your needs and your questions. And related to questions, we did receive some questions during this webinar, but for the fact that we're running close to the end of this webinar, we're going to follow up with all those individual questions that have been submitted, and we will respond to you. So we appreciate you attending and submitting those questions. So lastly, I just want to say a big thanks to Este and Phil for your support on this webinar. It was outstanding information that was presented. And then lastly, on behalf of everyone from Esri, I want to just say, please stay healthy and safe. Thank you.